creatine supplies energy to your muscles. Many people take creatine supplements to build strength and promote brain health. Creatine supplements are safe for most people to take, but you should first talk to a healthcare provider to ensure they're right for you. What is creatine? Creatine is a natural source of energy that helps your skeletal muscles flex or contract. It helps create a steady supply of energy in your muscles so they can keep working, especially while you're exercising. About half of your body's supply of creatine, 1 to 2 grams per day, about the size of 1 to 2 jelly beans, comes from your diet. Especially protein-rich foods such as red meat like veal and beef, seafood like fish and shellfish, and animal milk like cow, goat, and sheep milk. Your body produces the other half naturally in your liver, kidneys, and pancreas. They deliver about 95% of the creatine to your skeletal muscles to use during physical activity. The rest goes to your heart, brain, and other tissues. Manufacturers also make creatine supplements. Some people take creatine supplements because they work out a lot or don't get enough creatine in their diet. Creatine supplements exist as powders, tablets, capsules, liquids, and energy bars. Is it healthy to take creatine? Studies show that it's safe for many people to take creatine supplements. However, there isn't enough evidence to know if it's safe if you are pregnant or breastfeeding, have diabetes, have kidney disease, or have liver disease. If you have bipolar disorder, creatine may also increase your risk of mania. Talk to a healthcare provider before taking creatine to ensure it's safe for you. Does creatine make you gain muscle? It depends. Studies show that regularly taking creatine, weightlifting, and exercising can help increase muscle growth in people 18 to 30 years old. However, there isn't enough research to say that creatine helps develop muscle growth in people older than 65, or people with diseases that affect their muscles. Why do people take creatine supplements? Many amateur and professional athletes take creatine supplements to aid their workout routines and improve their recovery. Creatine creates quick burst energy and increased strength, which improves your performance without affecting your ability to exercise for longer periods. Most athletes who take creatine supplements participate in power sports, including bodybuilding, football, hockey, and wrestling. In addition, studies suggest that creatine supplements may help brain function in people 60 and older. This includes short-term memory, reasoning, and neuroprotection. Researchers are still studying whether creatine supplements may help people with cognitive conditions, including dementia. Talk to a healthcare provider before taking creatine supplements, regardless of your level of physical fitness, age, or health. Are creatine supplements recommended for athletes? Many athletes use creatine supplements. Professional sports organizations, the International Olympic Committee, and the National Collegiate Athletic Association all allow athletes to use creatine supplements. Men and women and people assigned male or female at birth report benefits to using creatine. But some studies note that women and people assigned female at birth who take creatine supplements may not gain as much strength or muscle mass as men and people assigned male at birth. What is the right dosage for creatine? A person needs between 1 and 3 grams of creatine a day. Around half of this comes from the diet, and the rest is synthesized by the body. Food sources include red meat and fish. 1 pound of raw beef or salmon provides 1 to 2 grams of creatine. Creatine can supply energy to parts of the body where it is needed. Athletes use supplements to increase energy production, improve athletic performance, and allow them to train harder. According to the International Society of Sports Nutrition, larger athletes who train intensely may need to consume between 5 and 10 grams of creatine a day to maintain their stores. People who cannot synthesize creatine because of a health condition may need to take 10 to 30 grams a day to avoid health problems. What is the most common type of creatine supplement? The most common creatine supplement is creatine monohydrate. It's a dietary supplement that increases muscle performance in short-duration, high-intensity resistance exercises such as weightlifting, sprinting, and bicycling. Other forms of creatine don't appear to have these benefits. What happens when you start taking creatine? Well, most creatine goes to your skeletal muscles, which convert creatine into a compound of creatine and phosphoric acid, known as phosphocreatine or creatine phosphate. Phosphocreatine then helps create adenosine triphosphate, or ATP. ATP is basically a source of energy that your cells use when you exercise. So, creatine helps maintain a continuous energy supply to your muscles during intense lifting or exercise. In addition to providing more energy and helping to increase muscle growth, creatine helps speed up muscle recovery. When you exercise, you create micro tears in your muscle fibers. As you recover, the micro tears in your muscle fibers heal, and your muscles get stronger. Creatine helps activate satellite cells in your muscles, which help the micro tears heal. Creatine also helps increase anabolic hormones. Anabolic hormones contribute to growth and tissue repair. They include insulin, human growth hormone, estrogen, and testosterone. Moreover, creatine boosts water content in muscle cells. Better cell hydration may increase muscle growth and reduce dehydration and muscle cramps. Creatine can also increase the amount of phosphocreatine in your brain, which may help with your memory. Should I take creatine every day? Your body is unique, and how much creatine you take and how often you take it depends on many factors. Before you take creatine, talk to a healthcare provider. They can help determine if it's safe for you to take creatine, as well as the appropriate dosage. What happens when you stop taking creatine? When you stop taking creatine, your creatine levels will gradually drop over the next few weeks. Your body will still make creatine naturally, but you may have side effects as you adjust to lower creatine levels. These side effects may include fatigue, loss of muscle mass, weight loss, and a short-term decrease in natural creatine production. You should be able to maintain any added strength through regular exercise, but you likely won't see continued improvement. What are the pros of taking creatine? For people who work out regularly, studies show that taking creatine supplements may improve their exercise performance, help their recovery after intense exercise, and increase their muscle mass. It can also prevent severe muscle injuries or reduce the severity of muscle injuries, help athletes tolerate more intense activity, reduce dehydration and cramping, and minimize muscle tightness, including muscle strains and pulls. If you're a vegetarian or vegan, you may see more significant muscle gains by taking creatine supplements because you don't get creatine through animal-based sources. However, building up creatine levels in your muscles may take longer. In addition to its athletic benefits, creatine supplements may benefit people who have neurodegenerative diseases, such as muscular dystrophy, Parkinson's disease, and Huntington's disease. They may also help individuals with diabetes, osteoarthritis, fibromyalgia, conditions that affect creatine metabolism, conditions that affect how creatine transports through your body, and insufficient blood flow to your heart muscle, known as myocardial ischemia. How much bigger does creatine make you? It depends on your exercise routine. But some studies show that people who take creatine supplements may gain an extra 2 to 4 pounds of muscle mass during 4 to 12 weeks of regular exercise than people who don't take creatine. Are creatine gains permanent? If you continue to take creatine, exercise, and eat the best foods to fuel your workout, you should be able to maintain the strength you gain from taking creatine. What are the negative effects of creatine? Creatine is a relatively safe supplement. However, side effects may include weight gain because of water retention, dizziness, nausea and vomiting, diarrhea, and excessive sweating, also known as hyperhidrosis. If you develop any of these side effects after taking creatine, divide the amount you take each day into smaller doses. Take these smaller doses throughout the day instead of all at once. Subscribe and follow our channel to get information about fitness and nutrition.